Hello, hi everyone. I'm Dr. Edita Lapitana Flores, a practicing obstetrician and gynecologist here in La Union. I have a clinic here in Lorma Medical Center. I graduated at the St. Louis University School of Medicine, and I'm a member of the Philippine Society of Gynecologic Endoscopy, Philippine Society of Cervical Pathology and Colposcopy, and Aesthetic Gynecological Society of the Philippines Incorporated. Today, my topic is all about Polycystic Ovary Syndrome. Ang Polycystic Ovary Syndrome or PCOS is a hormonal disorder. It is common among reproductive age among our women, and it is characterized by three. Irregular periods because you have irregular menstruation brought about by irregular ovulation. Second is the hyperandrogenicity. Ang manifestation nito or symptoms nito are like pimples, the presence of increased amount of male hormones, which is characterized as simple as oily face or pimples or presence of even in worse like presence of acne. And it may manifest also as facial hair or hair loss or darkening of our skin in our neck area. So it is genetically transmitted, and 20% of our female population are having this. So it's relatively common. Can PCOS be completely cured? Okay. So ang Polycystic Ovary Syndrome is a chronic condition. So it can't be completely cured. However, it can be controlled. It can be managed through primarily first, lifestyle changes. Anong ibig sabihin nun? We have to have good diet. We have to have exercises and weight management. We also have medications. So, ang PCOS ay primarily medically treated. Based on the symptoms, dun tayo magfo-focus kung ano ang iti-treat natin. Like, for example, if the problem is menstrual cycle, irregular menstrual cycle, dun tayo magfo-focus. Maraming gamot dyan for us to correct the menstrual irregularity. And then, with regards to the hyperandrogenicity, may mga gamot dyan. Like, we will discuss that later on. So, the focus, if the problem is hyperandrogenicity, we will reduce whatever the symptom is, like in acne or hair loss or any form of hyperandrogenicity. And also, as a complication or a condition of this Polycystic Ovary Syndrome, hirap silang magbuntis. So, another problem is the infertility. So, marami ring methods or medications to improve the infertility. Totoo bang birth control lang ang solution sa PCOS? Hindi. Maraming medications for PCOS, hindi lang birth control. It is only one of the treatments. PCOS requires comprehensive management, and it will depend on the symptoms. The best treatment options include, syempre, mainstay natin yung lifestyle. Hindi po mawawala yung lifestyle modification. And then, anti-estrogen, fertility medications, and metformin. Of course, there's a good impact if you have overall good diet. This will support the whatever abnormality like in any other disorder. So, dapat balance tayo. Next question is, pwede pa bang mabuntis ang may PCOS? Can they still get pregnant ang PCOS? Ang PCOS kasi, basically, walang ovulation or rarely nag-ovulate ang pasyente. So, nahihirapan siyang magbuntis. But there are ways for us to improve the fertility. So yes, she can still get pregnant since they can spontaneously ovulate. There are a lot of medications. With regards to infertility problem, we have several medications like clomiphene, letrozole, or gonadotropins, and combination of those medications. But we also have the in vitro fertility IVF, and a fertility specialist will help us improve the infertility problem. But even if you just do weight loss at 5% lang from your baseline weight, pwedeng maging regular ulit yung menstruation. Pag naging regular ulit yung menstruation, then ovulation can happen and pregnancy can follow. So just by weight loss alone, pwedeng mabuntis yung pasyente. And this will also be increased with the help of other medications. What other health risks should I watch for with PCOS? So, remember, ang PCOS is a comprehensive disease, or it will go from reproductive or even adolescent age, even extending up to beyond reproductive age. Kasi, if the Polycystic Ovary Syndrome is not treated, if remained untreated, yung diabetes mellitus, you will have 7 times higher risk of developing it. And then for hypertension, you have 4 times developing it. Meaning, if you have polycystic, chances are 4 times higher yung chances mo to develop hypertension if remain untreated yung Polycystic Ovary Syndrome. Pwede rin yung infertility. Of course, given na yun. Another dreaded complication, Polycystic Ovary Syndrome, is the endometrial cancer. The risk of having it is 5 times higher. Other health risks, syempre yung hypercholesterolemia, pwedeng mataas yung cholesterol level. As a consequence with that, you'll have risk for heart diseases. So, ano ba ang mga laboratory requests na pwedeng gawin if you have Polycystic Ovary Syndrome? We can include fasting blood sugar, hemoglobin A1C since mataas yung chances to have diabetes. Also, lipid profile, titignan kung mataas yung cholesterol, thyroid function test, androgen profile, LH, FSH, and estradiol, vitamin D level, kasi they have found out that patients with PCOS have low level of vitamin D. And of course, the usual CBC because it's a general laboratory request. So, anong advice for women with PCOS? It's not your fault kung nagkaroon kayo ng PCOS or Polycystic Ovary Syndrome since it's genetic. Pero pwede nating i-control. You seek medical help. We have many medications to control, to address your symptoms, including mental conditions. Sometimes nagiging anxious or nagiging depressed ang pasyente dahil may PCOS sila. Although this would be an extreme case, but some adolescent would find it very burdensome sa kanila. So, seek medical help or professional help from your obstetrician and gynecologist, internist, pediatrician, even your psychologist or psychiatrist, makakatulong sila. And self-care is very important. Makakatulong talaga if you increase your activity. This is one of the mainstay in the treatment of Polycystic Ovary Syndrome. So yon, yung overall treatment for PCOS would include lifestyle. Even weight management lang ang gagawin. This can address the irregularity of your menstruation, and if you have regular menstruation, ovulation can follow and infertility can be solved. Thank you very much for listening.